So, coming to the part 2 of varicose vein, in our previous video, I tried to give you the details of what varicose vein is, what are the classifications, and how do the veins become varicose veins, so the pathogenesis, and then we discuss certain symptoms with which the patient will come to us. Now, to continue with this, I'm going to tell you what are the signs of varicose vein. On examination, what do we notice? So, we will see that the veins will be visible, they will be dilated, and there will be distress to the patient. Patient will have nocturnal cramps. Patient will tell you that there is heaviness of the limbs and the edema will be usually present. The ankle joint movement will be restricted in some cases. Patient will present with pigmentation and sometimes with ulceration of the skin. Patient will sometimes present with active bleeding. Now, there are certain tests that you can go for, such as Trendelenburg test, which is usually positive in this case. So, when we empty the vein and we see the filling above the saphenofemoral area, the filling will be incompetent. So, this will be a positive Trendelenburg test. Another test that you can go for is Perthes test, which again will be positive, where patient will walk, and if you ask them to put a bandage around the legs, there will be severe cramp in the calf. Another test you can go for is cuff impulse test. This will be positive again, where if you empty the vein and you ask the patient to elevate their leg and you ask them to cuff, on that cuffing there will be an expansile impulse which will be felt, which is actually also called as venous thrill. So this will confirm the diagnosis of varicose vein. Right. Now, when we talk about the complications that we must bear in mind, if the veins ruptures, this can cause hemorrhage. Locally, the patient can have pigmentation, or it can turn into eczema or dermatitis. Patient can have venous ulceration of the skin. Now, in case the scar of the ulcer is unstable, the patient can develop squamous cell carcinoma. So, that is called as Marjolin's ulcer. Patient, because of ankle joint movement restriction, eventually can end up having ankylosis of ankle. So they will have difficulty in walking. This will restrict their walk. Patient can have calcification of the wall of the vein, which will be very, very hard and tough for them to live with. And again, patient can come with recurrent thrombophlebitis. So these are the complications that a patient can have. Now, when it comes to diagnosis, it is usually the clinical presentation that helps us to diagnose a case. But of course, we can go for certain investigations, like we can go for venous Doppler, we can go for duplex scan, we can go for venography to see the extent and the type of varicose vein. Now, for such cases, patients have to be advised additionally, besides the medications, to use crepe bandage around their limbs, or they can use compression stockings, easily available. And during the daytime, they must avoid prolonged standing and must use a stool to elevate their legs. Now, coming to the homeopathic therapeutics, I am going to give you a list of few remedies with their indications, just so that you can choose according to the presentation of the case. But there are again many more remedies. You can go with constitutional treatment as well, depending on what is the totality of the case. So the first remedy you can think of, which is very, very effective, is acid floor. Acid floor patients will give you the modality of pain and burning, which is relaxed with cold application, and the ulcer is worsened with heat in any form. Another remedy is calcarea floor. The indications are that, of course, there will be induration of the veins, so hardening of the veins or calcification of the veins. Patient will be relaxed by rubbing them or giving them warmth or moving about. Another remedy you can think of, commonly given in these cases, are carbo wedge. Now, carbo wedge has to have some blueness, coldness. Patient will be having low vitality, and this is one remedy that you can think of during the pregnancy in case the female is coming with varicose vein. And one modality is the patient will be very much helped by fanning. Another remedy that has to be considered is hemimmelis, where there is congestion, pooling or stasis of the blood, along with hemorrhage. And if the patient can also have associated hemorrhoids, then you can definitely think of this remedy. Patients will have bursting kind of pain in their limbs, which is worsened by any form of pressure or warmth or motion. Patient will have difficulty moving around, and also during the rainy weather they will have worsening of the symptoms. Another remedy extremely wonderful in these cases is pulsatilla, where the patient will typically tell you that I feel better when I stretch. So they want to stretch their limbs all the time. There is foul smelling sweat on foot. Patient have very changeable nature of symptoms, mental, physical, both. So there are wandering kind of pains. The patient will tell you different locations of pain, different types of pain. They can have associated numbness or heaviness of limb parts, whichever are laid on. Another remedy that you can think of is calcarea carb, where patients have a lot of cramps and burning, and of course the patient will generally be of chilly nature. Last but not the least, extremely wonderful remedy is Vipera. In this case, the classical presentation is that the patient will almost always be worsened or will be in very difficult position whenever they let their limb hang down. So the patient will be in a habit of raising and keeping their legs raised. So patient will tell you that they have a bursting sensation, as if their limbs will burst open because of the congestion. So Vipera can be given. Again, the remedies have to be prescribed depending on the totality, depending on the presentation of the case on individual basis, and the choice of potency will also depend on the severity of the case and the constitution of the case. So I hope this information is good enough. Please subscribe my channel because I'm coming up with more such videos and more details of day-to-day regular clinical cases that we see in our OPD, and how homeopathy works wonderfully and help us to manage these cases. Thank you very much.